usually it's like the last thing on their list.
According to the Better Vision Institute, 1 in 4 children who entered kindergarten last year in the United States are suffering from an undiagnosed vision problem.
You have all these kids in school that need to see the blackboard, need to see their books, need to process the information that the teacher's talking about. And so it becomes, actually should be top of the list of things to do.
What about the visit to the pediatrician and even the school nurse? They do vision screenings.
School screenings and pediatric screenings were never meant to replace a comprehensive vision exam. It's estimated that 70 to 80% of children can pass the screenings and still have an undiagnosed vision problem.
I decided to put my own children to the test. They have all scored 20/20 both at the pediatrician and at the school nurse. We started with Isabella, and because she still has trouble recognizing some letters, Dr. Kushner used both the tumbling E and the cover test.
You have to go to where the child is.
The doctors in our office have special testing paddles for infants. The older a child gets, the more information they're able to give to the doctor. But at 3 years old, a lot of times we use a tumbling E chart or a picture chart, because an eye exam for kids in an eye doctor's office is not only checking at 20 feet, it's also testing at near range, which is where 80% of learning occurs.
With infants, we have these smiley face paddles. And we can look to see if the smiley face grabs the child's attention. Then we know that they're seeing.
Isabella scored 20/25. Dr. Kushner says at her age it's common. Nothing to worry about right now, but he says we'll see how she does in her next appointment. Because Jerry and Nicole are 6 and 8, Dr. Kushner was able to use more advanced testing with them. And of course, they love the funny glasses. Those are used for the 3D test.
That's a critical test. That is like the crux of a lot of what we do. So in order to get good 3D vision, depth perception, both eyes have to be aiming in the same place at the same time.
Nicole scored 20/20. Jerry did not. Dr. Kushner proceeded to the near point of convergence test, which is also a measure of depth perception.
We're looking at how well a child can converge or aim their eyes inward, which is what needs to be done when they're reading. And if a child's having trouble sustaining that or doing it in the first place, it's going to interfere with the reading process. It can cause poor comprehension, loss of place, avoidance of reading, poor attention to task.
Jerry failed this test. Every time that Dr. Kushner told him to touch the metal ball, Jerry would point to the left or right side of the ball. He was seeing double. He was seeing a second image. Dr. Kushner says that's a problem, especially if the child is holding reading that close. Dr. Kushner says about 20% of the children he sees have the same problem.
Often that's mistaken for learning disability or reading disability, attentional issues. There's a lot of overlap of symptoms with convergence problems with other labels. And often there's a misdiagnosis going on.
I asked Dr. Kushner what are some of the things that parents should look out for that could be a sign that your child is having vision problems.
If a child has a 504 or an IEP plan, chances are there are visual issues going on.
What if that's not the case with the child, like Jerry, for example? I asked Dr. Kushner what are some of the other things to look out for.
Squinting, child complaining of blur, issues with school, issue with academics, if there's trouble reading, if there's behavioral issues with school. Is a child losing their place when reading? Are they not comprehending well?
What's the next step? How do you fix the problem? Dr. Kushner says he'll start by prescribing glasses, but when kids take them off, then you're back to square one. So he often recommends vision therapy, where he works one-on-one with a child to help develop better coordination between the two eyes.
In our office, we see infants. We're part of the American Optometric Association program called Infant C. So we actually provide a free evaluation for a child 6 to 12 months. We send a copy of that examination to the pediatrician so that they have it for their records. After that, really critical is age 3 before preschool, age 5 before kindergarten, and then pretty much annually is the recommendation for all school-age children.
If you want to learn more about children's vision exams and even the health insurance part of it, just friend Parentology Show on Facebook. I have all that information posted on there.